Hi, I'm Dr. Gomathi Narasimhan, consultant, liver and kidney transplant surgeon at Gleneagles Global Hospital, Chennai. I'm the organizing coordinator for the Masterclass in Liver Disease 2017. Conferences, liver conference or any other conference for that matter, there are umpteen number of them happening all the year long, and several with the same concept also. So this master class in liver disease is a liver based conference, but essentially the concept of calling it MCLD, like it's like a classroom kind of a discussion. That's what master class in liver disease, and you get it from the masters. This concept was thought about by Professor Mohammad Rela, who's the head of our unit. And Masterclass in Liver Disease was the first series was 6 years ago. First in the series was 6 years ago. What we're getting on to is the 7th Masterclass in Liver Disease. So this Masterclass in Liver Disease actually is a theme-based one. Every year there's something about liver disease, but we focus on one particular aspect. I mean, to give you an idea, the first few years or 1 or 2 years was on the general liver diseases that affect people, the liver tumors that affect people, the pathology of them, then the liver failure, acute liver failure. So we moved on one topic after the other, and the current one, which is coming up in January, is going to be back to the basics, meaning liver disease and transplantation. We're moving back to basics. After having discussing a little bit on a much higher level, our focus is simple things. Let me start from the topic itself. Why did we choose back to basics this year? Once again, after hearing a lot about very specified stuff, we understand that in India and in this part of the world, meaning Southeast Asia and in and around Indian countries, liver disease, recognition of liver disease, liver transplantation, it's in a very good growth phase currently. So more and more centers are interested in taking up liver transplantation, in understanding liver disease. So it is important to address the concerns of people who want to get into it, not just the people who are already in it and practicing liver disease. So we want more and more people who are getting interested into the topic to understand the basics. So it is going to highlight on the prevalence of liver disease in our country, world over. How is the growth of particular simple liver disease like fatty liver disease? We hear about it so much. So we're going to touch upon fatty liver disease. How is it important during transplantation? How is it important in the donor who's donating a liver? So simple practical aspects which will be of lot of relevance to people who are getting into the field. So that is the theme wise, that's the highlight of the coming conference. We have about 20 international faculty this year, which is probably the largest we've had in all these years and probably the largest in any of these kind of conferences. It's not just about the number that is important. We are getting faculty from several parts of the world. We have people coming from Japan, we have people coming from the US, from UK, we have people coming from several other countries in Europe. So it's going to be quite widespread in terms of representation. And the moderators and chairpersons are people in and around India who will understand the local disease pattern. So this will provide a fantastic platform for interaction from people who've done it over the years from the West to the relevant ones that's happening in our country. Like I said, India, Middle East, Sri Lanka, Bangladesh, Myanmar. So these regions share a particular common pattern of liver disease developing, because I don't know, it's maybe in the genetic makeup we're a little bit common. So the relevance, how we can bridge the gap in terms of knowledge between the West and this part. That's the focus of this year's conference. And the representation in terms of the audience is again going to be predominantly from the countries I mentioned in and around India, where liver disease, liver transplantation is on a huge growth spurt. In addition, we have several centers in India which have not yet started transplantation, but which have a keen interest to know about liver disease. So that will be the audience representation. Well, the simple answer would be hopefully this will translate to better quality of care, understanding of liver disease, identifying liver disease at an early stage, prevention of liver disease, because there's no point just addressing the end stage treatment option, which is transplantation. If we can start with identification of early disease, prevention of liver disease, and move on to actually picking up when complications develop, referring for a transplant, taking care of a transplant patient afterwards. So if this message goes through to again the countries which are seeing them more and more now, then I think we've achieved what we want to do from this conference. This is not a consensus meeting where we can come up with guidelines, but what we intend to do is to be able to circulate the content of our conference to the audience, and this meeting is also accredited and endorsed by several international liver transplant societies. Almost all the important ones: the American Society of Transplant, the International Liver Transplant Society, the Transplantation Society, the European Liver Transplant Society, all of them have endorsed our conference, and most of them are going to include our content in their e-learning. So that will have a very, very wide reach.